Well, thanks very much, Ingrid, and I stand on your shoulders in many ways for being here today, and hello everyone else. I hope you have enjoyed this conference. Certainly, I'm about to debate religious freedom next week, so I've been busy preparing for that, but popping in and looking at drug freedom along the way, and so it's, I think every time I've popped in, I've learned something new, which is always a very positive thing to say about a conference. Before I start, I would like to acknowledge that we are meeting on the traditional lands of the Wurundjeri people of the Kulin Nation and pay my respects to any First Nations people here today, and to honour the elders past and present, and also to put my heartfelt support and hope that Victoria reaches a treaty with our Aboriginal and First Nations people in the not too distant future. But I'd also like to pay my respects to the harm reduction pioneers and warriors here today. As I just mentioned, it's your shoulders I stand on. You are the reason I'm here, and probably in some ways the reason I'm still alive. I also would love to express my gratitude to the Progressive Public Health Alliance and all of them involved for the honour of standing before such a gathering. We're here as a collective, looking at all things fundamental to the well-being of every single one of us. And it's so important, yet so lacking in so many of the lives of others, including some of us here. So, can Australia lead again in public health policy? Can we be brave again? Well, it might be suggested that it's brave for a politician to speak of political courage when public faith in politicians has been dreadfully damaged by evidence. Politicians across the spectrum too often fail to put the public interest ahead of party interest, of personal interest, of family interest, of commercial interest, and of ideology. That's not brave. That's craven. I understand the public scepticism, but I believe there's a reason for optimism. Amid the muck shines examples of fine change. I believe most politicians really do ultimately want to make the world better and fairer, although the front pages of our newspapers are filled with the opposite right now. I believe evidence creates tipping points, and we are approaching some now. Evidence. It's the foundation of rational, ethical, efficient improvement of public policy. It fertilises progress. It fortifies public interest. The debates and presentations these past 3 days have been brimming with evidence-based argument. The case for change is compelling. We have to keep advocating calmly but confident that proof will prevail. We must trust that reason trumps ideology, fear and misinformation, because without this we're truly lost. But history shows us this trust is well placed. That we choose not to be lost is eminently fitting that this lecture memorialises Alison Chesney and Eddie Killoran. As Ingrid mentioned, these two were pioneers and legends. They chose to be pioneers of harm minimisation. They saved lives by shifting policies and practices from the criminal justice system to the health system. That might sound like a simple, sensible idea, but it was revolutionary. Alison, initially a psychiatric nurse by training, embodied the overarching idea of what I want to say today, that once the case for change is compelling, making change is not optional, it's imperative. It is a duty Alison met tirelessly in various public health and drug policy leadership positions and in the field. She understood the links between substance misuse, self-medication, lack of opportunity and support, historical neglect and sexual abuse. She trusted evidence and she trusted humanity. Eddie Killoran experienced addiction. He had much empathy for those in difficulty. Like Alison, he epitomised the rejection of injustice and uninformed authority. He suggested his greatest achievement at school was breaking into the headmaster's office and breaking the canes. His greatest achievement in life was breaking into public health offices and breaking those chains. Alison and Eddie met in 1982, working together on harm minimisation. Together, they also perhaps epitomised the notion that only the good die young, for they both died of cancer in 2006. She was 48, he was 54. Theirs was a love story fuelled by noble passion, passion to help others. And you might say too that they were brave. And indeed it does take courage to take on entrenched systems and beliefs. But what they most crucially showed was the power of proof. Prohibition, the so-called war on drugs, the proof shows a catastrophic failure. It's perhaps the most catastrophic public policy in modern history, wasting billions of dollars of public funds, creating a massive black market dominated by organised crime and killing thousands and thousands upon thousands of innocent people. Prohibition, a populist notion, even among those who claim to value freedom, should only be used as a last resort. Not only is it usually ineffective, it undermines personal liberty. It is government interference at its worst. Leadership is not necessarily about bravery. It's about asking one simple yet profound question: is this right? If the evidence shows a need for change, then leaders should argue a move for what is the case to what ought to be the case. If the evidence supports the status quo, then we should advocate against change. That's not radical, that's just plain rational. And we were brave in the 1980s. When there was a fear of an HIV and AIDS epidemic, we pioneered harm reduction. In Australia, we established needle exchange programs. They saved lives. This early introduction of exchanges shackled the growth of HIV and significantly reduced the prevalence of HIV and hepatitis C. They also saved scarce public funds. In every dollar invested into that program brought a return of nearly $5. We funded organisations to provide peer support to the LGBTI community, drug users and sex workers. We understood we couldn't stop people doing what they did, but we could make it safer. And I was there. I was with my friends. We accessed and volunteered on the mobile needle exchanges. As a sex worker, I benefited from the education that was entrenched. No glove, no love. Governments allowed us to take a holistic approach to harm reduction. We were funded not just to ensure that safe sex was practiced, but to advocate for law reform and better and safer working conditions, to address and challenge stigma and discrimination. Sex workers and drug users sat at the table with ministers and medical professions. They were a little bit afraid of us, but confident that harm reduction was right, and they were right. We were leaders, but we have lost our way. Well, not me, but the politicians, actually I lose my way all the time. Thank goodness for Google Maps. The politicians and the public health officials, say glib phrases like just say no. And this is coming back. It now seems entrenched again in the dominant rhetoric about whether we're opposing pill testing at festivals or alternatives to smoking. Australia long ago garnered the world's attention and respect for its tobacco harm minimisation policies that have cut the proportion of our citizens who smoke. to about 15%, as we just saw from Colin's last presentation. And those policies don't include prohibition, even though there is absolutely no way that tobacco would meet any legal approval these days. But our policies included education, regulation, medical support, taxation, plain packaging and advertising bans. The policies respect personal liberty. In other words, people are free to smoke but choose not to now because they know without doubt the costs. Why? The evidence. Yet, our absolute refusal to accept e-cigarettes and vaping is appalling and ignores that weight of evidence. The killer is smoking, not nicotine. If other nicotine delivery methods can reduce tobacco smoking, it is simply irresponsible to prohibit them. It is cruel, it is expensive, it is the antithesis of harm reduction, it defies logic. Yet, public health officials in Australia pat each other on the back, even while their moral panic is preventing Australians from accessing vaping legally, and it's literally killing people. Australia's smoking rates have plateaued, while rates in countries like New Zealand and the UK, where vaping is approved, are now lower than Australia and still declining. As we just heard, in 2012, the Australian government proudly set the target of 10% smoking rate by 2018. In 2019, the government has proudly set the target at 10% by 2025. New Zealand has a target of 0 by 2025, and they believe that vaping is intrinsic in reaching that target. We once were leaders. Our evidence shows escalating prison numbers are adding to the need for drug law reform. 70% of our current prisoners report using illicit drugs, compared to 12% of the general population. Around 50% of prisoners can be considered drug dependent, and 50% of detainees report that alcohol or illicit drugs contributed directly to their crime. Our prison rates are skyrocketing, and we have now returned to the rates seen in the 1890s. The 1890s. This, of course, has led to an increase in spending on corrections that, as we heard, it's $1.6 billion. This is outstripping what we spend on hospitals and schools in this state. Again, this cannot be overstated. Substance misuse is an issue best dealt with by the health system, not the legal system. Drug overdose deaths in Australia now outnumber deaths on our roads. We need to focus on wider issues and the issues that cause the harm: social isolation, homelessness, trauma and abuse. Try and treat the cause rather than the symptom. We need to take advantage of the highly urbanised structure of our population. It creates opportunities to link support services and treatments. A more connected city can, in and of itself, reduce harm. Loneliness has been shown to be almost as big a health risk as smoking tobacco. There is so much we can do on that front too. The UK government appointed the world's first Minister for Loneliness. Many nations are exploring ways to offset loneliness. Most positive evidence is being gathered. With our ageing population and an increasing reliance on technology, we should give this promising area appropriate priority immediately, including, if not a Minister of Loneliness, perhaps a Commissioner to rev things up. We once were leaders. We have a local example that illustrates some cause for optimism: the Safe Injecting Centre in Richmond. It's had its teething difficulties and somewhat vehement opposition by a small minority, but it remains supported locally and as well as in the wider community, because it's saving lives and it's connecting those in need with medical professionals who can treat that need. and that's why the centre is located within a broader community health centre. There has never been a recorded overdose in a safe injecting space anywhere in the world. In the months before the Richmond Centre opened, dozens of people died in the gutters and alleys of Richmond. Now, users are accessing health and other services. This is a community-wide economic issue, for there can be no prosperous high streets without healthy back streets. And another cause for optimism, and Ingrid mentioned this, is that the state government has actually embraced my call for the inquiry into cannabis. And that inquiry will ask the question, how do we keep cannabis out of the hands of criminals and children? Decriminalisation, education, regulation and health support are being shown around the world to reduce harm, drug usage, organised crime, addiction and premature death. And then there's the move just last week in an Australian state, the ACT, which has now legalised the possession of personal use of cannabis. Given the increasing global evidence, Chief Minister Andrew Barr was quite right to describe this as an evolution, not a revolution. Federal Health Minister Greg Hunt said he was concerned. But I think this is actually a positive sign because he's got no intention of overriding those laws. And so it's my hope that the Victorian Parliamentary Inquiry will help this state and others to continue this evolution and get us out of that primordial swamp of prohibition. Research by the Independent Parliamentary Budget Office at my request provides a fiscal buttress to our argument for the decriminalisation of illicit substances and the legalisation and regulation of cannabis. They conservatively estimated that these policies in Victoria alone would save the state $350 million in the first 4 years. So what else might we do to be sufficiently brave to do our duty? Well, we could stop imprisoning people because they use drugs. Accept that people use drugs and that our role is to reduce the harm. The truth is that most people who use illicit drugs do so relatively safely in the privacy of their own home. This is about informed choice and personal responsibility. But is it the pleasure that we experience that is so infuriating to those who impose their uninformed views? We should be focusing our attention on the small minority of people who need help. We should be allowing nicotine products that don't contain tobacco. And it's interesting to note today that in Australia, people living with HIV are far more likely to die of a smoking-related illness than AIDS. We need to focus on the root causes of problematic drug use. Let's build a fence at the top of the cliff rather than paying for the ambulances at the bottom. We should be offering heroin or hydromorphone to people addicted to heroin. And then we can deal with the substance that is far more likely to kill them, tobacco. We should fully embrace medicinal cannabis. We need to be making our cities 24-hour places and offer more than large beer barns. We need to put a spotlight on social isolation across all levels and departments of government. So the answer to the rhetorical question of whether we can be brave again is of course we can. Australia can re-emerge as a leader in this area, and we have a clear duty to do so. Ultimately, though, this should not be about political courage. Properly serving public interest means adopting evidence-based change that helps us all, but particularly the disadvantaged. Doing the right thing about public health is not about party politics. It transcends mere bravery. It's about values shared by most of us. It's about simple human decency. And it's not optional. Thank you.